So today we're going to talk about how global service reporting is changing, what procedures are required to report, who is required to report those, and when do the new requirements take effect. So as of July 1st, selected practitioners will be required to report post-op visits to CMS. CMS has identified 293 of those specified procedures that are going to be required to have post-op visits reported. So what are our post-op visits? Those are our visits that happen after the surgery. They can occur in a clinic, skilled nursing facility, ICU, and those are the visits that are included in our global surgical package, but now CMS is saying we need to submit those to us so we can see, how many times are patients coming in a post-operative period to be seen. Also, please note that any telehealth visits where the patient is located in an eligible originating site will also be required to be reported. So, which services? CMS pulled data from 2014 that were serviced by 100 practitioners. It was performed 10,000 times and have charges exceeding $10 million. Some examples of those procedure codes are CPT code 10060 for incision and drainage, 11200 for skin tag removals, and 67108 for repair of detached retina. A full list is provided on CMS of those 293 codes. For those codes, they will be updated yearly, and they will be published prior to the beginning of the reporting year. Also, any patient that is seen for a pre-op visit will not be required to report that visit to CMS. So, who's required to report? So, any of our billing practitioners, our nurse practitioners, our physician assistants, our providers, if they practice in one of the 9 random states that have been identified by CMS, they're in a group of 10 or more, and they're part of a practice that provides global services, will be required to report. If you are not in one of those states and don't meet the thresholds, but you still want to report, you are encouraged to do so. So the 9 states are Florida, Kentucky, Louisiana, Nevada, New Jersey, North Dakota, Ohio, Oregon, and Rhode Island. Those states were randomly selected by CMS for the number of Medicare beneficiaries in the area as well as the geography and the census division. So who's required to report? So we are looking at any practitioner that is in a group of 10 or more providers. They are required to report as long as they are in one of those 9 identified states that CMS has selected. If you are in one of those 9 identified states, but your group is 10 or fewer, fewer than 10, you are exempt from reporting. But again, should you want to report, you are encouraged to do so. So when do the requirements take effect? Well, those take effect July 1st. So anything that was provided or serviced on July 1st or after will be required to be reported to CMS as long as the service that was done falls into one of those 293 specified CPT codes. So we recommend that you get your staff up to speed, make sure your software is updated, and test the system. So there's been some questions about what happens if I provided services before July 1st. So any service that was provided prior to July 1 will not be required to be reported to CMS. For our Medicare Advantage patients and our VA patients, they are exempt from this. This is strictly for Medicare fee-for-service, and it's only when Medicare Part B is the primary payer for the global procedure. So how do we get those charges? How do we get those post-op visits to CMS. So CMS has done a really great job of working with the local Medicare contractors to make sure that they can accept those claims. What we need to do is put a penny attached to that 99024 and send it to our correct contractor. If we don't have a penny on it or there's no charge on it, it's not going to make it there. So we need to ensure that we are changing the price to 1 penny. So what happens in those scenarios where we either transfer our patients and we're doing like a managed, co-managed situation, or we have somebody in our group that sees the patient? If somebody in our group sees the patient and they're practicing under the same tax identification number, then that provider will be required to submit for the post-op visit. If it's a co-managed situation, so somebody outside of our tax ID, they, send the patient to see, another provider in the area to do the post-op, they will also be required. Now, they will only be required if they meet the sampling requirements. So if they're in the 9 identified selected states, and if they are in the group of 10 or more. If you are seeing a patient and you provide other services on the same day as the post-op, you still report the post-op visit. And let's say we see our patient and we're going to give them a flu shot, or they're complaining of an ear infection or, an upper respiratory infection, and we see them. Those other identified E&M services will require regular billing rules and requirements. You can still submit those, and you're still going to submit that post-op visit. You can do that on the same claim. It does not need to be separated out. So what if you practice in 2 different practices, or you're in like a moonlighting situation? You will still be required to report, even if you have a relationship with at least one group with 10 or more practitioners. You fall into the category of one of those 9 identified states. So if you're in 2 practices, one practice has 9, but the other one has 10, that practice with 10 meets the threshold, you're still required to report regardless of where the procedure took place. Where can you find more info? You can go to CMS. They have a listing of all of the 293 codes that have been required to report, and they have more information in regards to, who's required to report and, any other education materials that you may need. And that concludes our webinar for today.